It is the witching hour at 4 p.m. and you are listening to and viewing the webinar with Jerry DiPiano, CEO of FemmePharma Consumer Healthcare, and Dr. Juliana Hauser. Dr. Juliana is a sexpert who comes to us with a very distinguished background. And Juliana, perhaps you'd like to provide a few words on your background.
Oh, I am a couples and family therapist and licensed professional counselor. I am a sex educator and somebody who feels really comfortable talking about all things sex, sexuality, and sex education.
So Dr. Juliana can be found on her website. You can find her drjuliana.com. You can learn more about her and the type of work that she does with many different types of clients. Today, however, the conversation begins with how should healthcare practitioners be communicating and engaging in a conversation around sex? Seems kind of intuitive to me. I mean, at FemmePharma, we talk about sex all the time, and we're not intimidated to talk about women's sexuality, men's sexuality, same-sex sexuality. But what we've learned along the way is that isn't necessarily true with the healthcare practitioner community. Juliana, what has your experience been in terms of healthcare practitioners and their comfort level in discussing this with patients?
Mm-hmm. I'm going to add mental health into this part of it to say that medical schools, healthcare providers, mental health providers in most states and in most schools and most licensures do not have to have one class about sexuality in order to graduate, in order to be licensed. And that is shocking to me that that is still the case. It is just unbelievable that we don't even have to have one class. And yet, so it's one of the few things we as humans all have in common, and it is an enormous part of our life. And to me, one of the reasons why that this is still, I mean, besides if we're going to look at the patriarchal way that things are set up in our healthcare system, leaving that as the baseline, I think it's also that it is still such a taboo topic. And it is still viewed as something that is impolite. It is something that is someone else's issue, and that is not relevant to most of our healthcare, most of our mental health. I beg to differ on that. I think it is an enormous part of our life, our mental health, and our physical health. And I think it's because we define sexuality incorrectly. When we think that when we're talking about sexuality, that we're talking about sex acts only. And yes, that's a huge part of our sexuality, but it's not the only part of it. And so when we think that it's only relevant to what our bodies are doing and with whom, then it's easier to parse out what is relevant and what isn't. When we put it into a holistic way of looking at who we are and how we interact in the world, then it becomes extremely relevant. Just our education hasn't caught up. The other thing is that healthcare providers are humans. They were humans being raised by humans in a human society, and we are not educating anyone properly. So people who are going into the medical field are humans who have not been, in large part, being educated sexually at all. Or if they are, it is fear-based, it is taboo-based, and it is all about the bad things instead of showing it in a holistic way, or instead of showing how everything is intricately in place and pleasure forward instead of fear-based.
It's interesting that we tend to think about our healthcare practitioners, who, by the way, we have tremendous respect for, especially in consideration of what we've all just been through with this pandemic. So for those that are listening, we are big supporters of the healthcare practitioner community, nurses and doctors and allied health practitioners. But we do need to understand what the dynamic is that has been taking place. And it probably starts with the baggage that we've inherited, even from our upbringing, where our maybe cultural differences are at play, religious differences are at play, the way in which your family members may have communicated about sexuality or didn't communicate about sexuality. So we want to make sure that we give our healthcare practitioners a pass, but there is an opportunity to help to provide some enlightenment as to how we might encourage better communication and better conversation with the healthcare practitioner community. I guess the first question that I have, that I might ask myself if I were a healthcare practitioner, is how comfortable am I discussing sex with my patients? So doing a personal inventory.
Mhm. So I absolutely, this is key. It's important to check in with yourself to know, like, just in general, how comfortable am I with my own sexuality? And then also, how comfortable am I inviting the conversation from somebody else? And I want to double down on how much respect I have for the healthcare community. I actually come from a long line of physicians and nurses. And I think it's one of the reasons why I feel so passionate, is because I know that good-hearted, well-intentioned people are going into these fields and they're not being properly educated also. And yet are given the assumption out in the world that they're supposed to be, even though they just aren't. And they don't have tons of time to find this kind of information out on their own. Also, if their institution isn't providing it for them, or their training isn't. And so to ask the question, I've done lots of conversations with physicians about this. And when I say, you know, how comfortable do you feel? Sometimes the answer is, I don't even know how to gauge that. I feel comfortable with this, but not that. But when you open the door, you don't get to pick and choose what a patient is saying back to you. So a lot of times, if they don't feel comfortable, they just won't even open that, and will feel relieved if that is another patient that hasn't talked about it, and feels clenched up if the question comes up. And what I have found is where a lot of physicians are feeling the most discomfort is, one, they don't have their own comfort with sexuality and feeling like they know a whole lot to answer beyond the fear-based, medical-based aspects. They also don't know where to get the best information that feels reputable and science-based. And as you and I have talked quite a bit, there's not a lot of science-based research, especially with women and on women. And a lot of the research that we base things on are archaic and based on white men. So they feel they feel like they are using research that may not be the most up to date. So that feels tricky. And then they're not sure who to refer to. So it can be very difficult to get a basis of sex therapists, sex educators, sex health and wellness providers that are working with the healthcare providers, so that they, for the places that are beyond their scope, that they don't know who to send people to. So they have a discomfort of, what do I do if I open the door? And what happens, what kind of care and do no harm can I bring to my patients along the way also?
What if you're a healthcare practitioner and you do a self-assessment and you conclude, I am really not comfortable having this conversation? What do you advocate that they engage in some self-work? Because it would occur to me that the physician has to heal or the healthcare practitioner has to heal thyself first, where they can begin to do the good work of working on engaging in this conversation and providing a comfort zone for this person sitting across from them.
I do. I absolutely think that. And I'll back up to where I think it begins. And then for those who are past graduating, then I'll give answers to that. The first place is that I am just vehement that I think medical institutions and those who are training anyone in the medical community should be providing this. When I go to speak and when I advocate to become a speaker at a medical school or PT or nursing, I get met with so much resistance, and we already are too busy. We have too many classes that we're fitting in, too many requirements that we have to meet, and sexuality is a luxury. It's not a necessity. So I have to hit that hurdle. And that's the same thing that I think physicians are then receiving that message. So when you're practicing or you're in training or in practicing, you have to do the first assessment of, what is my bias against the relevancy of sexuality in general, and what relevancy does it have to my patients? And if the answer gutturally is not really, not my specialty, not my problem, then I really want you to get further educated, to go back to your alma maters, to say we need to be providing this. I am often, if I'm not told a no, I am told the next step typically is that, well, there can be a club. And if we can offer a club that you can meet over lunch for an hour, then you can come and speak for an hour. And that is the message that people in training are receiving, is the importance of sexuality. So I love it when I meet students that say, no, we want more. I work with a group in Columbia, and they wanted a whole weekend. They wanted the school to pay for a whole weekend of training. They knew they couldn't get a course, but they wanted something more than a lunch hour and more than a club. And sometimes it takes the people asking for it themselves for that to happen. And saying again, like, or going back to the administration after you graduate and saying, we need to do this. This is where I wasn't trained properly. These are the problems that I'm encountering. Please change this. And if enough people do it, then it will be something that changes. Unless they're getting feedback that they're not feeling properly trained, or it's not becoming questions on any of the tests that are having to happen before you can get your licensure, before you can get your internship, before you can graduate, then it won't be relevant either. I ask a lot about that, the questions that they're receiving on their boards, and it's very rare for it to be sexual in nature. And if it is, again, it's more that fear-based part of things that feels very specific instead of something that anyone may be able to encounter in what they're doing. For instance, like when I talk to people in the medical community of like, well, I'm not an OBGYN, so I don't really need to know, or I'm not a urologist, so I don't need to know. But you do need to understand when someone's saying this is affecting my sexual desire and my arousal with the medicine that you're prescribing or asking it, then you need to have an automatic comfort level with that. And you need to have the automatic assumption that it matters that you can protect their sexual health and their sexual life. If that doesn't matter to you, you're not going to be warning people of that when you're talking about the medicine, and you're going to be putting someone down who's taken the risk to say, my sexual health matters to me. Can you help me protect this, or at least be educated about it? So go back and tell your medical school about this so that people can be better, properly educated. If not, the next step that I find is that you have to be your own advocate. And this is in the mental health world too, that it's the rare workshop at a conference that is about sexuality, even in the mental health world, and it's even more rare in the medical community. So ask for those topics and find them. Find the continuing ed, find the people that are making the rounds, that are having the conversations. And if they aren't, then you speak to the people who are organizing these conferences and say, where's sex? Where can we get properly sex educated? Where can I get a panel? Where can I ask questions? Where can I get advice on this? And where are the peer-reviewed journals that are doing research and speaking to what I need to know in this as well? The squeaky wheel often gets heard, and that's what we need to have happen. Unfortunately, it's backwards. It should be the leaders and the educators and the founders that are doing this and saying it. But if not, the people who are in the fields that are seeing the problems when you're not educated should be the ones that are asking for it.
So if you are in the crop of up and coming healthcare practitioners, this is an opportunity for you to make a change.
Yes.
So what of those healthcare practitioners who've graduated from medical school, they are practicing medicine, maybe they've been practicing medicine for a decade or more. What advice do you have for them to get better acquainted with their own sexuality, their own comfort, and how that can be changed, how that can be redesigned, if you will, to begin undoing some of the, let's say, damage or lack of information that has resulted in them being uncomfortable?
So seek your own help too. Befriend sex educators, know people who are sex therapists, and do the work yourself. If you find that you're avoiding these topics, or when a client brings it up that you stumble or go to Dr. Google in the middle of an appointment, which happens quite a bit, then do the work yourself to know, where can I get comfortable? Where can I learn? And where are the places? Is it trauma that I've had that I haven't dealt with? Is it like a big T trauma that is obvious? Is it a small T trauma of rejection and feeling other than or feeling shame in who you are as a sexual being? Is it terminology? Is it that you feel confused about what to say to somebody who you wonder, or they mark that they are non-binary, transgender? Are you afraid because you don't know what to say? And you just need to be educated in that way. And if so, then find the time to be educated so that you know how to ask about pronouns, so you know what someone is saying to you when they're describing themselves and their gender identity or their gender expression or their sexual orientation. I've had lots of physicians say, I don't understand what this term is, so I don't attend to it. Or if they bring it up and they say it, I just kind of ignore it and figure out I'll find out afterwards. I often ask people, what are you asking on your intake form? And I learn a whole lot about that on what are they saying anything about sexuality on your intake form. And when I ask them about it, again, they often will say like it perhaps doesn't feel relevant. I'll ask about it in their life. How relevant is it in your life? And boy, does that change when we start making it personal rather than being in the professional aspect of things. And when someone feels uncomfortable about speaking about their personal part of things, then we talk about how bias makes a difference and how we have to do our own therapy or do our own sex education. There's lots of courses out there that you can do. There are workshops that you can do the work. Of course, I love the workshop that I do, and I find it to be a thorough review of your sexual journey and who you are in a holistic sense. And then I think what I have found is a lot of people have a hard time doing it personally first, so they connect professionally, so that they will start building a network of sex therapists, sex educators, and then they'll befriend them, and then they can start being immersed in that world and start asking personally on their own. I also think it's really wonderful when you are interacting with other professionals to talk personally about your sex life and about your sexual questions and what you are encountering in patients, so that you can talk to each other as well, and you learn so much more about not being isolated. I think so many people in the healthcare profession are isolated personally and professionally. It's busy. There's a lot of stress. You need to get patients in and out, and so it can very easily get myopic, and you miss the biases that you have and the own issues that you have in your own life. Everyone jokes that lawyers don't have wills, doctors don't go to doctor's appointments, therapists don't seek their own therapy, and they don't really say sex therapists don't have sex, though. That's just interesting. That doesn't seem to be like the quip that's added to it. But what I want physicians to realize too is that please do the work on your sexuality, because people are counting on you to look out for their sexual wellness and their sexual health. And they often look for you to set the tone for the comfort level. And it can be, it's a brave thing to bring sexual issues to a medical appointment. And it's even more difficult and frankly can be quite harmful if that's met with resistance, shame, or avoidance. And that can really be squelched by personal work and education.
Interesting that we, again, view the healthcare practitioners, sometimes whether it's the nurse practitioner or whether it's a physician or an allied health professional, they are not human. And you said this early on, they are human, and we all need to work on ourselves. And one of the ways in which we can work on ourselves is to go and seek some therapy to better understand how we interact with others. And it really comes down to the situational leadership. We use that as a management tool. You deal with different personalities differently. Otherwise, you can't be a good leader. The same thing applies to patients, based upon what I'm hearing from you. And knowing how you show up as a healthcare practitioner will often influence that conversation. So let's assume you've gotten comfortable. You're now working professionally with a sex therapist, psychologist, or someone that will work on your self-assessment. And you're feeling better about where you are with your own sexuality, and it's opening up the door for you to engage in more conversations. Now you're confronted with a patient. How do you create a sense of comfort with your patient before beginning that conversation? What are some of the techniques that you would recommend?
I love I love opening the door to like open-ended questions. Is there anything that you need to talk to me about? Is there any question? Starting off that way. And again, this is the assumption my answer is creating the perfect appointment. That doesn't often happen. And if I could create it, this is how appointments are, this is how I would do it. But I understand it can't always happen this way. But this is how I love to introduce this to physicians. So an open-ended question, and then say, is there anything that feels difficult or embarrassing to ask me? I want you to feel comfortable. Name the emotion that could be holding the patient back. When you say shame, when you say embarrassed, it can make someone like, okay, they get it. Or say, like I will often say, even with mine, like there is nothing you can say to me that I haven't heard before. I couldn't say that in the beginning, that wouldn't be true, but I can say it now and really mean it, that there truly isn't anything that I haven't heard or been asked. And so if that's an authentic statement, then you could say, this time is for you. And I want you to get out of it what you need. And I want you to know that there's no question or no situation or problem that is going to be embarrassing for me to hear. I understand it may be embarrassing or hard to ask, but I'm here for this. So that's open-ended in a way. And then again, it depends on the specialty, but I do think a lot of specialties is still relevant to say how, anything in your sexual health, anything going on with your mental health or your sexual health. Like I love that now there's a much more of a trend to ask about depression, to ask directly about domestic violence, to ask about those hard taboo topics, but they're still not asking, how's your sexual wellness? How's your sexual pleasure? How is your sexual life? Is there anything that you need support in? Do you have any questions about this? It's where we are the least educated in topic, but yet we're not asking. So I like asking those questions. Now, if you ask the question, you need to be able to have the comfort to answer them and sit in it, or have the comfort to say, that is a great question and I'm going to find out and get back with you. Or I have a resource that will be able to support you in this. I'm so glad you asked. And I think it's really important that if you don't have an answer or a comfort or it's out of your scope of practice, that you compliment them for taking the risk to say it. And what you're automatically saying is, it matters. What you're asking matters, and you can ask me in the future. I may not have this one because I don't know everything, but what matters is that it matters to you. So ask. And good, this is great. And I'm here again. I also think it's really important to ask multiple times. One of my favorite GYNs would ask 3 times. Any questions that you want to ask me. And when I was younger, it would take me sometimes to the 3rd time for him to ask me, for me to say it, although I knew exactly what question I wanted to ask in the waiting room. But I just felt ashamed or felt hesitant, and I wasn't sure if the question made me weird or abnormal. And probably in a very subconscious way, I didn't know if they'd be able to handle a question like that too. So just hitting it, being obvious and saying that up front, I think makes a big difference. I love it when my clients tell me that the healthcare providers that they're working with automatically say, let's talk about your sexual health. Or for those who I consider advanced, and I love these people too, it's like, are you having pleasure in your sexual life? Do you have any questions about your anatomy? Do you have anything that I can support you in your sexuality? Anything you want me to know?
Those are wonderful open-ended questions. I wonder, and you probably know the answer to this, of course you do, if your patient is of an opposite sex, right? So male physician, male NP speaking to a woman versus same sex persons of the same sex. Mm-hmm. Is there a way that dynamic can be worked through to help the conversation operate more smoothly?
Mm-hmm. Yes. And so let me step back from that. Yes. You have to be mindful that you aren't making assumptions of somebody's gender or gender expression, which is why it's really important to put on your intake asking people their pronouns. So that's the first part. And if you haven't done that, then I like asking, no matter what, if I have an inkling or I don't have an inkling, tell me your pronouns before you begin. And I think that automatically provides a level of trust for people as well. So after you are sure that there is a gender difference, then I love naming it. Just like when there's a race difference, when there's a cultural difference, just say, like, I will say I identify as a white woman. And that is my experience. I've done a lot to educate myself, but there'll be places that I miss. I'd love to know if there is anything that I can do differently, or anything about your experience as a Black woman or a woman or whatever transgender person that you need me to know. And I don't love when we ask someone else to do the work for us. And so it's not just like, teach me everything, but I also think it's important to just acknowledge I don't know everything, and I don't know your lived experience, but your lived experience matters to me. So if I get it wrong, please let me know that I'm open and I'm working on this. And I think that is a beautiful, safe place to allow that to happen. There is still quite a presence of people not wanting to work with somebody who isn't in their gender. And what I say to people is, I mean, there's some reason, especially if there's trauma, or if this is just how they've been socialized, that's not what you're supposed to do. But I don't find gender to be the part that makes a physician or a medical provider so wonderful. I have had same gender providers that weren't so wonderful, and I've had other gender providers that were incredible. I find it to be the vibe, the warmth, and the relationship beyond that. So I love advocating for my clients to meet the person and not the gender. But if you're the provider, then it's okay to acknowledge that. And I appreciate when it is a male identified provider and there's the exam that's starting to happen and they bring in the female coworker. I love the acknowledgement of that before it happens too. And to say for safety's sake, for comfort's sake, we'll bring somebody else in. A lot of people, once you get a certain age, understand that that's what it's about. But I like acknowledging why it's happening. And I think all of those places, all the chances that you can take to say you're safe and your safety matters to me, because you want to be able to provide to others. I am a safety conscious provider because sexuality often is inherently unsafe for a lot of people. That matters, that is inherently important to people. And then I really like saying, and if I get some of it wrong, I am doing the work to change and to learn and to grow. And that is the advanced level. It shouldn't be advanced, but it is advanced for others. And I recommend doing that highly.
I really like the way that you approach your own vulnerability and becoming self-effacing by stating things like, I am a white woman. I don't know necessarily what you're experiencing as a person who identifies as a Black woman and or a person of a different sexual preference. So that level of vulnerability probably goes a long way with making your patient feel more comfortable that you may not have all the answers for their particular situation and particular needs, but you can surely navigate through that with them, help them to find the resources, and you can be partners in this.
Yes, partners, collaborators, and a provider who has expertise more than the other person, but not the expert of them wholly. And so you're wanting to invite your patients into the co-collaboration and for them to have agency in this as well. Because there's nothing more sad for me when I hear a client who has left a medical provider's office and hasn't asked the question they need to ask because they didn't feel safe enough or welcome to, or they felt afraid. And it wouldn't have taken a whole lot to have gotten them to open up their piece of paper and ask the question. And it was just well-intentioned, but a missed opportunity. And I think for me, it goes back to that this is training, and it's also the system of providers have a lot of pressure on them, and to make money, to get people in and out, to diagnose, to make the right diagnosis, to hear that there's a lot of things that providers have to do in a very short amount of time. And so then you start triaging and prioritizing what's important. And I want to be an advocate that sexuality shouldn't be considered a luxury, and that safety should be a mainstay no matter what whatever your specialty is.
Well said. we in particular know that the demands that have been placed on the healthcare system and healthcare providers have been enormous, particularly in the last several years. And much of that is not going to change because we've also observed that there are many who are leaving the profession. Lots of nurses, healthcare practitioners, they're just burnt out. And adding one more task may seem pretty daunting to them. So we want to make sure that any of our healthcare practitioners that are listening in, we are 150% behind you, and we support you and salute you, and hope that some of this information will resonate with you so that you're more comfortable dealing with questions of sexuality, because it does impact every aspect of our life. There was recently an interaction that I had with a healthcare practitioner that I was working with, and we talk about body language. And this was an individual who actually was a gynecologist. And you would imagine that in gynecology, the individual would be super comfortable about talking the topic of vagina and vulva and other anatomical parts that belong to persons identifying as a female. But when I started inquiry with this individual about the work that we do, she turned her eyes down and folded her arms across her chest. And she asked me whether I was uncomfortable talking about problems down there. And I looked on the floor because I was curious. I was, what's on the floor? And I realized that she was uncomfortable with the words that I was using. So body language, we always use the old expression, you have to walk the walk and talk the talk. So it's one thing to say, I'm super comfortable having this conversation with you, and you're blushing and your arms are folded and it's clear you're uptight.
And uncomfortable. And again, I'll go back to inhuman. And it takes a lot of work for most people to get comfortable with sexuality. And again, we assume that the healthcare providers are given all the adequate training to do that. We know that they aren't. And we look for them to know what we don't know and to have that comfort level with it. And what I would say about that provider is we have a large network that would like to support you and to help you get comfortable, because it's not easy. It isn't easy. And it's important. And there's so many times when I hear clients coming to me of what harm has been done. And I feel pretty certain most of it is unknowingly, that the provider has never been given feedback, has no idea that the blushing or the arms or the saying down there or those, or like asking the question but not really answering and not really listening and like looking down or on the computer and like like I'm asking because I'm supposed to, but I don't want the answer, or I don't have time for the answer, how much harm that does to others. And to me, it goes back to training. I want them trained better so that they feel more comfortable. And I want their sexual health to have mattered so they understand that it matters to others too. And this is not everybody. I mean, I certainly work with some incredible providers who get it, who have done the extra work and have asked and has seen the difference it makes. But most of them, they either had it inherently in their own life, and so they knew it was going to make a difference for their patients. They had a very good mentor who said, listen, this is important, or they got the feedback that it made a difference. And so I would love it to be a fourth category, which is just inherently it's a part of things, and that providers don't have to work so hard to get this extra benefit, and they don't have to keep advocating to, like, where are the sexual health workshops? Where can I get this CE? Where, if I have to go ahead and get this continuing ed, can you make it easier for me to have access to it at this conference? I wish it wasn't so hard for providers to get this comfort level for themselves too.
It's clear, having done a little bit of research leading up to this webinar, that we're starting to make some strides. And I did see that on several of the society websites for rheumatology and oncology, there were some guidelines as to how to approach the conversation around the impact of diseases and disorders and symptoms on one's sexuality and on sex, both. And I believed that was really good progress. Obviously, that's in its infancy, because as I continued to do more research leading up to this webinar, it was clear to me that there was very little information by comparison to what one may find in other areas of research in medicine. And mental health is obviously become more prominent these days, because we know that individuals that are living with various conditions may experience depression, anxiety, etc. So that's an obvious one. But the sexuality and sex aspect of this, there really isn't a lot. There's a dearth of information out there. Have you found that to be the case, Juliana, or what has your experience been?
That things are getting better, but it's still not good enough?
Yes.
Yes, absolutely. Things are better, and there are institutes like the Kinsey Institute who are making strides and are scientifically based and have a good reputation that people are using. But even still, there are still people in the medical community that don't know what the Kinsey Institute, beyond that it was maybe an HBO series. And yet this should be something that we all know and that can have access to, because they are doing really good research. So I have to balance myself too in this, that I want it to be fixed and I want it to be right. And I feel so passionate that I know if we could change and have the ripple effects of sex education in medical schools and for our therapists, for everybody, that we are going to be able to make huge strides in a quick generational change. I want it to be quicker than it is, but I also acknowledge that it is getting better. It is getting better. There is more money going towards science. There are companies like you, there are leaders like you who are saying this matters, and it matters to all of us. And then we're not afraid to have a webinar like this. We're not afraid to have products that are enhancing this. I saw about a year ago that the Michael J. Fox Foundation did a seminar on Parkinson and sex. And what did we do? And I was so thrilled to see that. There's a lot of work with spinal cord injury and sexuality. What does this mean? And that it's important. And I love the message that sends, that we care that people's sexuality is affecting them and their sex acts, and that sex acts matter. We know that it makes a difference in relationships and connections when people are sexually fulfilled. But it's more than just sex acts that we're looking at, and we need to not think like it's this dirty, awful, taboo thing. I also want us to continue to see the effects of that, and I wish that more providers made more of an effort to have connections and networks with sex therapists and sex educators, and paid them better. And valued that profession in a way that says this is really, really important. I'll give an example where a place where it may not have seemed so obvious. I work with young clients like in college who are having anxiety and depression issues. And their side effects are a lowered libido and erectile dysfunction issues. And so they don't take their medicine. Because they want to be able to have sex that weekend, or they want to have the chance to have sex that weekend, or they want to just kind of feel vibrant again. So then they have mental health concerns beyond that, which then leads to other physical problems that they're having, that they're not being managed in that way. And all of that could be changed if we felt comfortable, or we had relationships that work together with sexual health. I feel like pelvic floor therapists are just doing God's work out here, and that they don't get nearly the kind of attention that they need, and that it's a profession that isn't known nearly as well. And I think just like providers should know sex therapists, they should know pelvic floor therapists. And not just for those who have vulvas. It's a really important field for everyone. And I also think those who train pelvic floor therapists should be a part of helping train and make the training for other healthcare providers, because they've gotten it right. They've gotten it right how to make it a normal thing to want to have better sexual health, and to want to know the connection between your anatomy, your health, and pleasure and sexuality.
It's a very important field of expertise. We work with pelvic floor PTs, physical therapists. They have special training. There is a certification program, and for anybody that's listening that isn't familiar with pelvic floor physical therapists, I encourage you to do a little research. Herman Wallace is the accrediting body that I'm familiar with, and you can find pelvic floor physical therapists across the country, in your state and in your region, and even in your city. So yes, absolutely. Having met several along the way, it's an understatement. I would say that they do great work. I agree with you. They do fabulous work, and they are definitely an allied health professional that's worth knowing if you're an HCP, or if you happen to be a layperson listening to this webinar. They are definitely very helpful. And they do destigmatize this for persons identifying as either male or female or transgender. So it is very important that we take that into consideration when we think about how to refer. You mentioned this early on in the webinar. How do you refer someone on if they express to you that they are having difficulty, and this may be a physiological issue that they are struggling with, and that is definitely a professional that may be able to provide some additional support and help. You know, we also, when someone shows up, we sometimes make judgments based upon their age or their physical appearance or their marital status. And I'm wondering if, when a healthcare practitioner brings someone in, if they don't have the inventory where they actually look at that information, they develop some sort of a bias. So if we could talk for a moment about getting that inventory. So doing that assessment with your patient before they walk in, might be a new patient, or could be someone that's been your patient for 20 or 30 years. How important is it to get that inventory done before they walk in the door? And how can you benefit as a healthcare practitioner by doing that? Where can you find such an inventory if you don't have one that you're presently using?
Mm-hmm. So it goes back to that conversation about biases. Like, first of all, you have to ask that question. You have to be brave enough to be authentically to answer it, because every single one of us has a bias, and that is just an impossibility to avoid. What we can do to overcome that is to educate ourselves. What do we think? What do we know? What do we think about these? What do we feel comfortable with? And I always go first, like, what do you feel in your body? If your body changes when you see a certain looking client, or you think you hear yourself avoiding questions, or for sure asking questions, saying things differently, then your bias is right there. And start with that. Find other people who are experts in it. Find people who are safe and willing to do the work, that are consenting to educate you. Don't just assume someone wants to educate you about their marginalized place in the world. But I also think it's really important, like what you said about when you're looking at, to answer your question first, is there an inventory? There isn't an inventory that I have found satisfactory that is set. You can do your own and check in with yourself about this. I think it's also interesting to find out, it's not just how you're responding to a particular patient when they're coming in your office, it's what kind of patients are you drawing to you? Do you find that you have a subgroup that never comes to your office? And maybe you're okay with that, and that's just the lane that you're in. But if you're wanting that to be different, how is it that you're advertising? What is it like with your staff? Is your staff doing bias education also? The people who are answering the phones or setting appointments or greeting your patients, are they creating a community that is open and honest and free of biases, or at least aware of what their biases are? Even down to what is in your office. Is every picture a woman and man holding hands, or in your artwork, is there anything that shows any kind of racial diversity, gender diversity? Are there slogans? Are there bumper stickers? Are there any of those kinds of things that can be subtle clues that you're a safe, inclusive environment in that? And if not, ask yourself why. Is it just because you have a certain aesthetic that you want? And if you don't want to change the decor of it, is there an opportunity to do it different ways? Pamphlets are okay. I mean, I kind of like, well, It's better than nothing. But I don't think pamphlets can make up for all of that. Nor can a bumper sticker. I mean, you can't have the appearance and not the action to back it up. But there are ways to do both that can bring people in, and then once you're there, that you're a safe person with that. Another thing that I recommend to people is to have a survey afterwards. It's hard to get people to do surveys, and I am someone who doesn't love doing surveys myself, and I will always press no if I'm given that option. But if you make there be a survey that is a couple of questions that's particularly bent to this, like how are we doing with the way that you're showing up in the world and the needs that you have, or how are we doing in addressing your racial needs, your sexual needs, it's doing very specific and not being afraid to say it. You are going to change how somebody has access to healthcare by having by doing it and by saying it. People are thinking it, and they're either not coming back to see you, or they're not asking the questions that are going to make their healthcare better, or they are afraid, and you're adding to the fear that the healthcare doesn't care about them in particular. So those are some of the things that I would do, more of an outward way. And then going back to the inward way of looking at it is I check in with my body, or I help people check in with their body about how they're reacting to it. And then I pay attention to how I act in my personal life. How do I talk? When the eyes aren't on me and the professional code isn't on me, where is my biases in my friendships and jokes and what I'm consuming in the shows that I'm watching? And you will find the biases that will be absolutely showing up professionally too. Sometimes it's just harder to see it professionally.
Interesting that in my personal experience, healthcare practitioners that I have been engaged with over the years are individuals who are pretty hyper empathic and pretty comfortable with themselves. Mm-hmm. So there is that meeting of the minds. They don't have a problem speaking my language because my language can be pretty graphic and my conversation is pretty direct and open. And that's probably why I've continued to work with them for, in some cases, more than 20 years. My gynecologist is a woman who delivered my daughter 27 years ago. And as you're sharing this information, she's a lesbian. She is very open-minded. She has a very diverse population. And it occurred to me, it's probably the reason that we continued to work together, because she is very open-minded and diverse. And her patient population is super comfortable with her because she's also open about her own sexuality.
She's authentic and vulnerable.
Yeah, she is definitely vulnerable. Same thing with my primary care practitioner, who happens to be a guy. And he's not uncomfortable having the conversation about sex and sexuality. And he has maintained a practice in the area with folks that he's known since high school. So it does, that advice is really good advice. He built his practice, she built her practice in order to retain that patient population. And it really came down to, I want you to feel like there's nothing that would make me uncomfortable, because here's who I am. Here's who I am. Here's how I operate. Mm-hmm. And it really has served them well. And it certainly has served their patients, me being one of them, served me very well over the years. Mm-hmm. So we talk about terms and terminology. Obviously, I speak in some clinical terms. So when I have my interaction with my own healthcare practitioners, I'm probably speaking in clinical terms, but obviously not everyone does that. So how important is it to focus on terms that are relatable to patients that you're seeing?
Oh, it's so important. It's important to normalize it. It's important to do education when you can. And it's important for people to feel safe enough to tell you the truth of who they are. And I'd say, especially in the world of gender identity and gender expression, there is a lot happening in these past few years that have scared some people that weren't brought up in this, weren't educated in this, and may have their own personal feelings about what it means. That doesn't mean that you shouldn't educate yourself. In fact, it means you really should educate yourself of what this means. It's not hard to Google this. It's not hard to Google what are the terms or the continuum of gender identity, gender expression. What should I know about gender? There will be so many things that pull up and that will give you a word and the current definition of it. I don't think that Google is the best place to learn everything, but it's not the worst place. And it's the starting point. And if you come upon the word pansexual and you're like, I have no idea what that means, and there's a definition of it, but you are feeling this like ugh to it, or this like whatever about it, then that's the term you go and you look more on. And again, like I am a huge proponent of having your intake form really be inclusive, and doing as much as you can, and including the current words and the current ways of looking at things, and also asking and saying like, did I get it right? Did we get it right? Is so powerful. Those patients will come to me and say the providers that they love the most, the ones that made them feel like they matter, made them feel like their healthcare mattered, and that the office in general, but everyone within it, wanted to do right by the person, even in a quick-paced amount of time. It doesn't take a lot of time to ask, did I get it right? It may take a lot of time to listen or to care enough to put action into it, but don't be afraid to ask it. There can be powerful changes made in a short amount of time too, with it. Also, in getting to know the organizations that oversee sexual health, like the ASECT, is a really important organization to know, and to get on their newsletter list, to go on the website every once in a while and find out what are the new things that are being explored, that are the new terminology that you should be up on. Quad S, which is 4 S's, is the scientific part of sexuality, and they are the research-based aspect of things. ASECT is the educators and therapists. And Quad S are the science people who are doing the science and presenting their research on it. Both organizations can, even just going to their websites, can educate you in a quick way. And then I also, depending on the size of the office, I like to have someone that's designated to sexual health, that they are getting the office up on terminology, making sure paperwork is matching that, making sure people understand what that is, and inviting people in for a lunch hour. To educate. Like, we want someone to come in and tell us all about the terms. What are all the gender identity terms? What are all the sexual orientation terms? And educate us about it so that we know.
This conversation that we're having, and the topic of how healthcare practitioners should begin the conversation with their patients, is really pretty genericized right now. But obviously there are subgroups, and there are ways in which to communicate with adolescents, and ways in which to communicate with individuals that are at the height of their reproductive years, and then in perimenopause, menopause, or andropause. And those are special skills that need to be cultivated, because there are different issues that are confronting sex and sexuality at each of those age group cohorts, and different segments of our population. That is definitely something we need to talk about in a subsequent webinar, because it is different. So thinking about that, even thinking about different specialties and different types of approaches. We talked about the rheumatologist. We could certainly talk about the cardiologist. Having had way more experience working with cardiologists than I will admit to at this point, it's clear that both men and women who have cardiovascular events will suffer issues that pertain to sex and sexuality. And those are special issues. So even thinking about subspecialties. So again, there's a much larger conversation when we start to take all of that into consideration.
And I want to, I love that. I love you always think like that. And I'm here for it in those conversations. I want to, it reminded me of something else in a subgroup that you mentioned earlier. I had a dear friend of mine who's 76 call me a couple of weeks ago, and had been widowed and was recently dating. And she said, I am having the best sex of my life. And she's like, I didn't know who else to tell. And then we started talking about, where does she get educated now? And what does she need to be considering that wasn't relevant 15, 20, 40 years ago? And so also, I love to speak to, for those who are working with populations that are older, do not forget that their sexual health matters the same, and that they could be vibrantly sexually active or wanting that or surprisingly having that. And so don't rule that out, and don't forget to ask them too.
Well, having been somewhat acquainted with independent living communities, because my my dear mom, who is no longer with us, was living in one of those communities. There was a lot of sex happening in those independent
Yes.
living communities, more than I ever would have imagined. There was a point at which we thought about leaving samples of our product
Yes.
in the restroom, in the various dining halls that were in the facility. But it's true, thinking about individuals who may be older, we shouldn't take that for granted, and they have special questions, concerns, even about sexually transmitted infection.
Absolutely. And pleasure and lubrication and yes, and feeling 50 and feel like I don't want to be discounted in my sexual vibrancy. And I certainly want the medical community to be waiting for me when I hit that age. Be
Absolutely.
there for me.
Absolutely. Well, Juliana, we are close to the time when we must conclude this webinar. This has been wonderful. Again, having you join us for the webinar on how healthcare practitioners can improve the conversation on sex with their patients. For those of you that are listening, you can also tune in to our Love Mia Vita podcast. Dr. Juliana is a guest. She's been a guest on numerous occasions, and we will continue to have her as our guest, speaking on all topics that involve sex and sexuality. She is a psychologist. She has a vibrant practice, and she is available for consultation. And you don't need to live in Kentucky. So she's based in Kentucky, but you don't need to live in Kentucky to reach out to Dr. Juliana. Just check out her website, drjuliana.com. Again, thank you so much for being part of this webinar. For those of you that are listening in, we hope that this has been informative, and please stay tuned for the podcast. Stay tuned for the next webinar. We hope that you enjoyed learning a little bit more about how to approach the conversation on sex and sexuality.